Hello, everyone. It is my pleasure to join you today. I am Dr. Karina Leandria. I am an anthropologist who specialized on health vulnerabilities. I'm also part of the HTAC Core Committee. Aside from the clinical and economic assessments, HTA also reviews the ethical, legal, social, and health systems impact, or ELSHI, of the use or non-use of health technology. Here, I'd like to emphasize that we've incorporated an interactive approach involving relevant stakeholders in HTA to improve its applicability for the intended population. We do this in a real discourse, often through a consultation. We also conduct literature searches to identify relevant issues in the ELSHI domain. Equity is an important aspect of UHC. In health, equity means everyone receives a fair opportunity to attain their full potential, with no one left at a disadvantaged state. In reporting equity implications, we organize them as Progress Plus, which stands for the factors you see here on the screen. To identify factors that affect access to or quality of care received and gather needed information, we use qualitative methods such as in-depth interviews and focus group discussions. Progress Plus helps us determine populations most affected in health decisions. For example, it allows us to prioritize groups for immunization programs. Factors we consider include physical or social vulnerability and religious or cultural norms. We also explore legal issues of health technologies through relevant local and international regulation involving patient rights, disease-specific laws, and other relevant policies. In our setting, we use the UNESTA-developed ELSI checklist to assess and report the ethical, legal, and social issues in the implementation of a proposed health technology. Lastly, we consider the health technology's possible impact in our health systems. Here, we assess the capacity of both the public and private sectors to implement a health technology and how it can affect other roles of existing divisions or organizations. In this process, we collect data using qualitative methods in consultation with DOH program managers, HCPs, LGUs, and other relevant stakeholders. As we've discussed earlier, a systematic review usually takes about 8 to 12 months. But for public health emergencies like COVID-19, we follow the expedited process and conduct rapid reviews for 1 to 3 months. To end the session, we've learned that the HTA Methods Guide sets the methodological standards informing the HTAC's recommendations and decisions through clinical, economic, ethical, legal, social, and health systems impact assessments. We've also learned that both the methods and process guides help advance inclusivity, transparency, and accountability. Lastly, we've learned that recommendations rely on stakeholders with different backgrounds of clinical and non-clinical expertise. All these help ensure our recommendations are grounded on scientific defensibility, ethical soundness, and local applicability. Evidence-based recommendations can help us improve the overall health outcomes and ensure fairness, equity, and sustainability of coverage for all Filipinos. Thank you very much.